Okay, so we'll go on with the next presentation, which will be a Pharma Mart Symposium. The title of the presentation is Current Evidence of Topical Treatment of Venous Leg Ulcers.
Good afternoon again. I'm happy to be with you again. I would like to share with you the message just came from Algeria. Professor Mohammed Ayed and the Algerian friends were online with us watching what we are doing. And they said the message just arrived from Dr. Mohammed.
Dear colleagues, dear friends, on behalf of the Algerian College of Vascular and Vascular Surgery, our society that president, it is a true honor to have given me the floor to welcome you to this beautiful city of Fakhry, the 1st and 2nd May of this important congress dedicated to vascular disorders in children. This topic, the why, is vital. It challenges us to not only as specialists, but as caregivers committed to protecting the future of our youngest patients. We are proud to support this international initiative, and we salute the outstanding efforts of our Egyptian colleagues, particularly Professor Ayman Fakhry, in bringing it together. Let this Congress be a moment of knowledge sharing, connection, and innovation, driven by science, inspired by compassion, and united by purpose. I wish you a fruitful and inspiring meeting. Thank you, everybody.
It's my pleasure today to discuss with you the current evidence for topical treatment for venous leg ulcers. The objective of our talk today to give the message from the American Venous Forum Research Committee and the Egyptian Venous Forum Board. I would like to bring attention to the use of topical wound care for venous leg ulcer as critical gap is in knowledge and encourage scientists, pharmaceuticals, and industry to cooperate to fill this gap to provide suggestions for directions for the future research and address areas for therapeutic uncertainty. I don't have any disclosure. As you know, this study run through 5 steps: identification of the research, literature research, screening for duplication, identification of the studies, then summarizing the results. This is the Prisma technique for how to make your meta-analysis objectively. They came to from this study for that venous ulcer is a chronic inflammatory process with tissue loss and impaired healing resulting from unregulation of inflammatory cytokines and the proteases, reduced growth factors level, and impaired cellular purification and internalization. As you know, try and error approach. Most of physicians have been infrequently exposed to patient with venous leg ulcer during training time, early at their real life practice, and learn more and more from their seniors or by applying the principle try and error. Topical wound care therapy. Topical wound care is relatively expensive and will typically require multiple outpatient encounters. Overuse of topical topical therapy for venous leg ulcer might divert the treatment regimen from the appropriate use of more effective and less expensive systems measured to other directions. The literature, PubMed search using the keywords venous ulcer, dressing, or topical treatment did more than 2,000 challenging and time-consuming. The clinical practice guidelines from the Society of Vascular Society of Surgeons, SVS, and the American Venous Forum and Wound Healing Society remain the most comparable and comprehensive resources to date for the evidence related to the prevention, diagnosis, and management of venous leg ulcer. As you know, 2/3 of leg ulcer have a venous etiology, which translates to about 1 to 3% prevalence of venous ulcer in the general population. At least 1/3 of these ulcers will recur within 3 to 5 years. The average cost of treatment of these ulcers in the United States is about 15,700 US dollars, and the estimated annual cost reaches about 15.6 billion US dollars. The strategy of venous leg ulcer, some venous ulcer will heal spontaneously without any treatment. The natural history of this ulcer not been well understood, and the recurrence seems to be inevitable. As you see, this is the ulcer and the aim and the strategy of our treatment. The key, what's the key? It is imperative to view topical treatment as an adjuvant to systemic measures in the complex therapy for venous leg ulcer. Effective management of venous ulcer should always target the principal treatment. The rationale of treatment, effective management of venous ulcer should always target the principal pathology. Evidence of venous reflux emerging will support early elimination of superficial reflux to treat this ulcer. Often setting of superficial or deep reflux or venous obstruction, or both, up to 1/3 of venous ulcer will recur within 3 years. Failure of these results could be initiating careful re-evaluation for compliance with the class 2 compression stocking. Patients who are not compliant with compression will experience recurrence 20 times more than others. Systemic antibiotics, when it is used, if it is needed for systemic causes. Recurrent ulcer, long-term prospective study of venous ulcer recurrence after many topical wound management are currently lacking. Despite the leap from ancient medicine to the application of contact therapy and engineering skin substitute may be elevate the evidence for treatment of leg ulcers in an evidence-based method. That's why we designed our evidence-based trial. We made this result as a safety and efficacy of Zymulge gel in the treatment of chronic venous ulcer. It is done for 40 patients were admitted to the Royal Vascular Center with chronic venous ulcer from January 1st, 2023 to December 31, 2023. They are divided randomly into groups. Group B treated with Zymulge and compression. Group B comprised 20 patients and treated with traditional dressing with compression. The primary endpoint was determined as complex wound healing within 3 months of treatment with or without correction of venous insufficiency or arterial disorder. All patients subjected to exam, and as I told you about The results, the range from 39.8 and 39.82 in group A and B. Complex and complete wound healing observed in 20 patients, 100% in group A, while it was achieved in about 15 patients, 75% in group B. Duration within 3 months was occurred in group A, with a mean duration about 9 weeks.
Dr. Ayman, we have to conclude
Yes, I concluded.
according to your instructions.
Yes, I just finished my talk, and please mark your calendar for our meeting next year. And I want to tell you, you have a questionnaire in your hand. We are going to initiate another study about venous or chronic leg ulcer. Please join us and share your opinion with us, what you want from us to do, what your objective, and what is the message you want to deal with in the next study to increase the library of such a treatment. Before I go, I would like to share with you our video production. This is the first video production. We are celebrating with you the famous Arabic doctor. We share with you Ibn Sina.
Avicenna, also known as Ibn Sina, was one of the greatest minds in history, a physician, philosopher, and scientist whose impact still echoes today. His most famous work, The Law of Medicine, was the medical encyclopedia of its time. Shaping healthcare for centuries, Avicenna pioneered clinical diagnosis, emphasizing symptoms, pulse examination, and disease classification. He was among the first to suggest that diseases spread through air and water centuries before germ theory. His contributions to pharmacology introduced drug testing and the study of medicinal plants. In astronomy, he challenged ancient models, while in physics, he explored motion and energy. Avicenna also helped establish hospital-based medical training. Shaping modern medical education, his legacy continues to inspire scientists and doctors worldwide. As he said, the knowledge of anything is incomplete unless known by its causes. Avicenna, the genius who changed the world.
There were some